My name is Leon Bertos. I work in the marketing field. I am 69 years old and I live here in New Jersey. The procedure I had was total ankle replacement, which I didn't think was possible, having spoken to a few other doctors. But when I approached Dr. Green and he looked at my situation, he did tell me that that could be done, so I decided to go ahead with it. I was having a lot of pain walking, and all my friends would say I'm walking with a limp. It was difficult to sort of get around, so I went and saw a few doctors and I spoke to them, and they said that ankle surgery wasn't an option at the time. I decided that I was going to pursue it even further, and Dr. Green was recommended to me, and that's the reason why I went to see him. It was difficult for me because I really couldn't walk very far, and it was particularly evident when I had some friends come over from Australia to visit us, and we went into New York City, and they were walking around and I couldn't keep up with them. I had to stop every 10-15 steps and try and manipulate my ankle a little bit so I could feel a bit more comfortable. That was an eye-opener for me, and that's basically one of the things that led me to seek further medical expertise, and that's where Dr. Green came into it. Yes, I received physical therapy, and when I saw Dr. Green, he actually put me onto what he called a pre-op physical therapy program, which helped to loosen the ankle quite dramatically, and I think that helped an awful lot. I have never had surgery prior to seeing Dr. Green. This is the first surgery I've ever had, so I was very apprehensive about it. The most difficult thing he told me would be to sit and have my foot elevated for 6 to 8 weeks. He said that is the most difficult part of the recovery program. So he was right in that too, actually. It was very difficult. Not having had surgery before, I really didn't know what to expect. I saw Dr. Green and he conducted the surgery. After that, I had absolutely, it's amazing, I had no pain. It really is, it's amazing, no pain whatsoever. For the entire period, 7 months after surgery, I'm walking up to 5 miles a day and I still don't have any pain, so I'm really ecstatic about the way that the surgery went. My quality of life has improved dramatically. The fact that I can walk the distances that I walk without pain. We've just come back from a vacation where again we caught up with the same friends that we had in New York, and we walked around Vancouver, and they were surprised at how I could keep up with them and how quickly I could walk and the distance that I could walk. And all this was done with virtually no medication whatsoever, and really there's no support on my ankle at all. I'm just walking like I would normally be walking now. That's what makes me feel that this surgery was very, very successful. You don't want to be walking around in pain. You want to be able to keep up with everyone. And if you've got issues with your ankles, I think Dr. Green would be a great person to go and see. I know that I'm recommending him because of the experiences that I've had. So I think give it a go, and I'm sure you won't be disappointed.